So this is Dr. Thomas Young. We're talking about the intense pulse light treatment. Today it's for the face. The other name that the med spas call it, they call it photofacials. Okay, so it named its own thing. It's using pulse light, so it's a little step down from the laser. The pulse light is a great treatment for reds and browns on the face. We use that all day long because that's what we all get with our signs of aging. We're going to use the Palomar Icon. It's one of the staples, the gold standard for IPL. All right. So the first thing that we're going to do with our treatments, Nicole is going to help us out with our pretty patient Kelly. All right, the first thing we're going to do is we're going to do our skin tell, which is going to help us get the amount of color in her skin, because we can tailor the treatment to how much melanin she has in her skin. The reason we do this at every treatment is she might, depending on the time of the year, she might have gotten more sun, and also her brown color and some of her color will go away with subsequent treatments. So we use different settings in November than we do in June. So we're using the Skin Tell, which is directly hooked up to the Icon machine. And that's going to help us customize our settings in a more effective and safe way. So she's going to take 3 separate readings in areas that are similar to what we're treating. In her case, it's easy. We're just doing her face. And that's going to transmit it right over to the machine. Popped right up. So the next step we're going to do is we're going to put a little topical numbing stuff on. The treatment's a little pinchy. Some people do without numbing, but most we do a little numbing on it. So we're getting ready to do her IPL. She was numbing for about 30 minutes. First thing we're putting on is we're putting on the contact gel. Helps the light make better contact with the skin. We use eye protection because the pulse light can be a little bit damaging to the eyes. So the settings we've chosen for today are 40/15. They're a little bit on the aggressive side. The reason for that is this is our 3rd treatment. It's the middle of winter, and we use the Skin Tell to get the parameters. So setting the parameters is very important. And now what Nicole's going to do is she's going to methodically go around the face once. Sometimes we do twice. Sometimes we do extra. Some of the trouble spots, capillaries, brown spots, we'll hit them 2 or 3 times. But one good pass is sufficient.
Yep.
So the pulse light goes down there, it's absorbed by the color. So it's absorbed by the reds and the browns, the target. It's usually pretty well tolerated, a little pinchy, but pretty well tolerated. And then we'll see how she looks when we're done.
I'm just going to apply some of our SkinCeuticals Physical Fusion Defense SPF, which must be done after every IPL. We just got rid of all that sun damage, so we want to make sure that it doesn't come back.